I think we got a little complacent. I think we were opening things up. That wasn't inappropriate. It's part of the deal, is you try to lock things down to give yourself a chance to get smarter about the virus and build capacity and build testing and build contact tracing and get PPE and all that. We did all that. And so it was perfectly reasonable to begin loosening up a little bit and seeing how things go. And they haven't gone well. And they've gone worse than I would have expected. And they've gone worse faster than I would have expected. And so, it's time to say, we tried that, it's not working, we have to pull back. And next time we try it, we're going to have to do it a little bit more slowly, a little more carefully. And we have to make sure the people are on board, because it's one thing for the governor to say, do this or do that. It's another to make sure everybody is out there wearing masks and keeping their distance. I think people got a little bit sloppy.
As for the California miracle,
it is dead. I hope it comes back, but we really did have a miracle when you look at the size of the state of California and where we were on March 1st. There was absolutely no reason to believe that we would be spared. There was, and every reason to believe that we would have an experience just like New York had. So there was really no good reason to believe that we weren't going to get crushed. 30,000 people had died in New York State and a couple of thousand in California. 20,000 had died in New York City and 50 in San Francisco. It's staggering. So we did really, really well, but the miracle is over. Now we are sort of just like a lot of other states. We dodged the first bullet, but we're catching this one.
You hate to hear that, but of course California is a big state. The bulk of this is in Southern California and the Central Valley, but there are neighbors.
I think the narrative a couple of weeks ago was that's a Southern California problem. We're good in the north. It's just not really true anymore. It's worse in the south, but there are plenty of counties in Northern California that have measures that tell us that things are going off the rails here too. Not quite as badly as Imperial or Kings or even Los Angeles, but Marin is having a spike, and Santa Clara is having something of a spike, and Contra Costa is having something of a spike. And San Francisco is worse than we were a few weeks ago. It's still not, it's not terrible, but the number of cases has gone up a lot. The number of patients in the hospitals has gone up considerably. So it's patchy, but it's pretty broadly distributed now throughout the state.
So what can we learn from this? It seems to be that the prevailing wisdom was that if we open slowly, not too quickly, monitor that we could continue to open slowly. Is that still going to be the case, or could we see rollbacks continue?
The next couple of weeks will tell us what direction that we can go in. I think there's a constant push from the people and from the businesses and from the governor and from the mayors to try to open up. But the message from the very beginning from a lot of the public health experts was this is not public health versus the economy. If we don't get the public health part right, you can't do the economy. We have to really think not just about what are the policies and the rules, but what is the normal behavior of individuals, because this really is more about what every single one of the 40 million of us does every day. And they're not going to anytime soon be going out and arresting people who aren't wearing masks. It's going to be much more about, if you don't wear a mask, how is that going to feel? Are people going to come up to you and say, why aren't you wearing a mask? And that hasn't happened yet, but that needs to happen.
Is it still possible that if I'm reading you right, that we could still reopen cautiously if people wear masks, and if everyone wears masks, or the most of us do? And if I'm hearing you right, it's just that not enough, a high enough percentage of people are choosing to wear masks.
I think the masks are the most important thing that we could do. I think if people reliably wore masks in all of the activities where they're coming in contact with other people, we would markedly decrease the transmission rate, and we would stay on top of this. The virus doesn't care that we had a really good March, April, and May. It's just sitting there waiting to pounce. And if we let our guard down, this will be what happens. And so this experiment has failed, the experiment of opening up at the pace that we did in the way that we did. The new experiment will be, okay, let's go back 10 yards and let's try it again a little bit more slowly, but with people being a little bit more careful in all of their daily personal behavior. And that is not impossible that will be a positive experiment. That it's perfectly reasonable to believe that if we get it right and everybody does the right thing, that we will be able to move forward and open up more and more. But I think we had this illusion that because we had 3 good months, we were out of the woods. We're not out of the woods until we have a vaccine that works and is in the majority of our shoulders. And at best, that's a year from now.